welcome to Keene.
Thank you.
Welcome back to Keene. I saw
you.
you last year. So now you're running for governor, and why don't you start with what you feel sets you apart from kind of a crowded field?
Sure, absolutely. Well, there are 4 candidates in the race, and I like to kind of cast myself as the real conservative with real experience. And what I mean by that is I believe in limited government, personal responsibility. I'm pro-life, pro-Second Amendment, and I've taken the pledge against the sales and income tax. 2 of the candidates have not. I believe, we are facing a real crisis in the state of New Hampshire when it comes to the heroin and opioid issue. Two of the candidates believe that we should decriminalize marijuana. I'm absolutely against that. There's one candidate who's open to an increase in the minimum wage. I don't support that idea. I'm not establishment. I don't come from establishment. While I've served in the Senate for 6 years, I come from community. That was kind of what incentivized me to run in the first place 7 years ago, was having been a former town administrator, having worked on Main Street with small businesses through the Main Street program, and being a small business owner. I went to Concord with this idea that we needed a voice in Concord for people, small businesses and communities. And so in the 6 years that I've been there, that's exactly what I've done, is been a voice for communities. And I think if you look at me compared to any of the candidates in the race, I have a proven track record. I have a record of showing that I fight for community, that I fight for people, that I support community and people and small businesses. And I think that really is what sets me apart. And I guess the other thing is that when I signed up to run for governor, I took a pledge that I would not run for any other higher office, that this was going to be my number one priority, was focusing on the issues facing the state of New Hampshire. And I would say I consider myself a very serious candidate in that I was the last one to jump into this race, the first one to lay out an economic plan for New Hampshire. I've laid out a government reform plan. I've laid out a health care plan, and I've laid out a plan for the heroin and opioid crisis. So whoever takes a corner office after the November election is going to have to hit the ground running. And, it's a 2-year cycle. It's very short. So you need to figure out what you're going to do now, or at least be thinking of concepts and ideas about how you're going to move the state forward.
Sure. So you position yourself as the, I guess, a political outsider or the anti-establishment candidate, but you're actually, as you mentioned, you're a 6-year senator.
Yeah.
When we saw you last, you were making the rounds of the state with the Senate Majority Leader and Senator Little here.
And the Senate President, I believe, right?
Senator Morse.
Yeah. President, yes. Yeah. I'm sorry. I get my levels of government mixed up sometimes. So that the people you're running as a state rep, a one-term executive counselor.
No, he's in his 3rd term.
Or I'm sorry, the 3rd-term executive counselor and city mayor.
Yep.
It would seem you're the most establishment candidate in Concord.
Yeah, I would disagree with that wholeheartedly. And I say that again because I have, in my opinion, I've never been part of the establishment. And I'll give you a good example. When I went into Concord 6 years ago, one of the first votes I cast as a freshman, 23-1 against Democrats and Republicans, on a piece of legislation that I had heard would hurt my communities. So you can imagine as a freshman what that was like to push up against your party, because there were 19 Republicans total in the Senate. And I went up against them, and in fact everyone else, because I had heard from my communities that this was going to downshift, it was going to hurt them. And so I voted. I was the lone vote on that issue. I fought the establishment. I went toe-to-toe with the establishment on protecting private property rights when everyone else wanted to see this project go through and not protect private property rights. I worked with the Senate to turn that around to make sure we established stronger private property rights. And so, I fought the energy lobbyists. I fought the establishment in the Senate on that issue, and we won. So no, I don't see myself. I've been there 6 years, but I think the other thing that you could check on my record is that I'm there for my constituents, and I spend the most amount of time that I can in my district fighting for my constituents, and that is the other thing that sets me apart. So if you talk to any of the folks in District 2, the 27 communities that I represent, I think you would hear a story about somebody they don't consider to be a politician or establishment. So I would push up against that.
Okay.
It's not a matter, I guess in my mind, if how you categorize somebody as establishment as years served, I don't categorize myself that way. It's not years served, it's service to community. It's serving your community, and that's what I've done.
Is that a one or the other type of thing? If you're looking out for your constituents, you can't be establishment or vice versa?
No, not necessarily. No, it's not. But again, you asked me how to differentiate myself, and if you're looking just because you said at the outset 6 years,
Mm-hmm.
One has been in 6 years. There's another who's a second term, in their first term, and then there's the mayor, who certainly was probably the most establishment in my opinion, because he was a state senator, then he became mayor. So he's probably had the longest in terms of state government service.
Okay. We'll move on to some topics of
Sure.
before the government. So one thing that people in our area are very concerned with, we have a number of communities with very high local tax rates. And a lot of that has to do with how schools are funded in New Hampshire. And people are also concerned with the quality of education that students receive, because so much of local education is based on local property taxes, and tax assessments and valuations vary from community to community. It seems children in one place are getting a different education or different level of education than in another across the state. How does the state serve to kind of even that out and make it fair, make education fair across the state?
So the question is how to make education fair across the state. Well, let me start by saying this. I think that I'm a big proponent of local control. I believe that parents and communities know best what is best for their children. So I support school choice. I support charter schools. In fact, I'm a founding member of a charter school in Franklin, Compass Classical Academy. Homeschooling, private schools, public schools. I support all that. The bottom line is there should be choice. Parents should be part of that process. And in the local community, having that conversation with school boards about what are the best programs for their communities is an important conversation to have. So it's really, when you talk about fair, each community has to decide.
But if a community doesn't have the resources that a community down the road has.
Well, and part of that is, I think we've got an issue relative to, as you said, funding special education. As I go out of my district, and it's been consistent through the 6 years and more. I'm hearing it more and more often. I want to say my last term. It's this idea of special education, how it's really impacting communities in a negative way. One child is really hitting state budgets, or not state budgets, but local budgets very hard. And one of the things that I've done every year since I've been in the Senate is I have a roundtable with the superintendents in my school, and we talk about what are the problems facing you. Funding always comes up. what's more recently has been special education. So we've been talking about how do we solve that problem in terms of the impact on budgets. And one of the things we've been talking about is this idea of is there some kind of creating a regional network of risk sharing for special education. And it was something we started to work on. We have to get back to. There seemed to be great interest at the local level for that kind of idea. One of the things I did in this last session, because hearing about this problem with the impact of special education, was worked to create a legislation that looks at having the Department of Health and Human Services work with the Department of Education so that, and it's called a system of care for children's behavioral health. You know that in the mental health settlement, they neglected to address children's mental health. This legislation that I introduced and the governor signed into law looks at how HHS and DOE work together to identify what's going on with the child, to make sure that we're not working at cross purposes about the care they get, because we know if we can get the child the right kind of help at the right time in the right place, we avoid that costly residential care in the future, which is what's impacting our communities. And so that's my initial attempt to try to solve that particular issue when it comes to education and the education spending.
Can I just ask a little bit? It sounded
Sure.
almost like you were suggesting some sort of system that would enable a regional approach to things. Is that, did I hear that correctly? I don't want to put words in your mouth.
Two different ideas that I was talking about. First of all, the first idea that I talked about, which was that came up in a superintendent's meeting, was this idea of a regional network of towns pooling together resources. Whether the state kicks in or not, you have to look at that. It's a conversation we have to look at, and what the dollars mean for that. But working together so that these towns are not so negatively impacted. And it's risk sharing. That's the concept I talk about, the regional
And so it
network.
requires some sort of enabling legislation kind of thing.
Right.
Yeah.
Right. But one thing I have learned in the time I've been in the Senate is that communities have some really smart people and have some really great ideas about how to solve their problems, and we just need to be working with them and listening to them about how we help them. And I said it earlier, big proponent of local control. So.
Right. Sure. So on energy,
Yeah.
Prices are very high, to put it mildly, and there's a lot of solutions on a lot of proposals. I was wondering what yours were to start with. How do we bring down energy costs? Is there something that the state should have an involvement in terms of the companies themselves and trying to make them more profitable, or is there another approach?
I think definitely we need somebody in the corner office who's going to take a leadership role on this, and as governor, I would do exactly that. I have gone around talking to the various stakeholders. Stakeholders, whether it's utilities or the consumer advocate or others, businesses, about what's happening out there. And we know that part of the issue of high energy costs is this idea of transmission. Transmission costs are high. We're building out the infrastructure with ISO New England. We're part of that. So that's one piece of it. Regulatory environment is causing a lot of that. Stranded costs, through Seabrook or whatever other projects that are being passed on to the ratepayers. And so what it has been kind of interesting and frustrating is that you talk to one and they point the finger at the other, and it goes around and around, and we never get to a solution. And as governor, what I would do is bring these stakeholders into the room and say, we've got to figure out a way that it works for New Hampshire. How do we reduce the energy costs for our residents and our businesses? This is a critical issue. This is really important for our economic development in the state, and if we don't get this right, if we don't solve this problem, we're gonna start seeing more and more businesses leave the state. So it's a stakeholder process.
How much power does just the state of New Hampshire have, being in a regional grid?
Well, that's absolutely part of the problem. Is, we're just one little piece in it. But I don't think there hasn't been any leadership on this issue, and that means sitting down with the other governors in that power pool and talking about how do we make this work. And it's being forceful, and it's being not sitting on our hands and letting it happen to us, but being very, again, forceful about how New Hampshire is going to at least be on par with the rest of the New England states and not take the back seat all the time.
So you mentioned bringing stakeholders together. That would presumably be the companies too. I mean, what would the state's involvement with those companies be in terms of anything that the state could? I mean, would it just be kind of consultation, or would there be actually any measures taken with regard to, you were mentioning regulations? Is there anything direct with a direct legislative interaction between the state and these companies that you would consider if you were to meet with them?
Well, so again, it's a conversation that you have to have with them. There's nothing that I have ultimately that I think is going to be the solution until you get them all in the room. Again, they all tell something different, point the finger at the other person. When I talked to one utility company, and he said that he believes what's going to happen is we're going to have to look at local power to eliminate the high transmission costs that we see in our bill, that we're going to have to start thinking more creatively, whether it's solar. What he mentioned was solar, and this idea Tesla's developing the battery so you can start storing the energy, because right now we lose that through transmission. If it's not used, it's lost, and so we have to figure out again. And going around the state meeting with different businesses. I was down in Rochester and met a business there who's doing some really creative stuff to lower their energy costs. And I said to him, well, this is really kind of a neat idea, and because it's saving him so much money. I said, have you talked to anyone at the state about this, or how we bring this across to all the businesses? And he said, well, I have, but nobody seems to be interested. Well, that's what we need to get together, is the sharing of ideas with businesses, because he wasn't the only one. Then I went to another business, and they're doing kind of something the same, a little different, but getting them all in the room, and they're sharing the information about how they're getting things done. But it's like we're in these different silos and nobody's talking.
So you mentioned solar just now. I just wanted to pivot to renewables, and I know that you have some experience in this with your business. So I just wanted to ask on that, when it comes to expanding into renewable energy, solar, wind, that kind of thing, it sort of seems to be easier to pitch as a wide collective effort than to actually pitch on an individual level. And when people have to actually deal with what it means to have these for instance, wind farms near them, there tends to be more local opposition. So I guess first off, what is your position on renewable energy, and how would you expand it, given those factors?
Well, I think that renewable, everything needs to be on the table in order for us to move forward in New Hampshire, and whether it's solar, wind, fossil fuel, nuclear, hydro, whatever it is, we need to consider it all. I just want to go back and say our business, the business that my husband and I own, is an environmental technology business. So it's not about energy. I just wanted to kind of clarify that. But I think renewables are good. It just has to make sense, and we have to look at the dollars of it. And it seems to me everything to some extent is subsidized. The other thing I didn't mention that I'm a big proponent for is the biomass industry. In my district, I have two wood burning facilities, Indec Energy and Bridgewater Power, and they provide a really, I think, great service to the state and to local communities, because they're taking the bad stuff from the woods, that's the unusable stuff, if you will, the coal. And they turn that into chips, and it feeds the biomass plant that creates energy. And that whole industry there supports all kinds of jobs, from the loggers and the truckers to the auto parts dealers. And these people make good paying, they have good paying jobs, and they're involved in communities. So that's part of the mix too. And we need to make sure that industry remains viable, especially when we're the second forested state in the country. And we have the woods, right?
Ron, I'm sorry.
All right.
You want to take over the...
Thanks. Good to see you.
Senator, you talked from the outset about the opioid crisis, the heroin crisis, as being high on your priority list. And nothing speaks to the scope of this problem more to me than the fact that our local fire chief dispenses weekly, if not bi-weekly, stats around here. 6 overdoses in 5 days, 3 times Narcan was administered. It's sort of, these numbers are floated like so many baseball statistics. Could you speak with some specificity about this plan that you talked about that you have for the state and its people to get its arms around this problem?
Sure. So I sit on the Governor's Commission for Drug and Alcohol Treatment, Prevention, and Recovery, and I sat on the task force this last year. So perhaps better than any of the candidates who are running, I have experience on this. And in fact, I worked for a drug and alcohol treatment facility many years ago, Odyssey House, if you're familiar with it. It was a drug and alcohol residential treatment facility for youth. So 4 years ago in the Senate, I was working on this issue before it came really kind of to a head, and I talked about getting, and actually fought to get, more funding for the Governor's Commission for the programs that they were working on. I fought to get more funding for prevention education, which is Life of an Athlete, if you've ever heard of that program. It's targeted towards athletes in the schools. I was successful at that. So in this last budget, we have spent 75% more than in the last budget. All told, I checked the other day, probably $101.5 million is what we're spending in the state. So certainly we're spending money on this issue, and we want to make sure that we're spending it on the right programs, right? So I've got my program it's called Take Back New Hampshire, and it's prevention, education, enforcement, and treatment and recovery. So prevention education, what I talk about is this idea that education needs to happen early and often, K through 12, consistently, the messaging, right? And it needs to be science-based. Just like we taught young people why it was bad to smoke cigarettes by showing them the diseased lung, we talk about the science behind drug addiction, and we teach a child, that if you do drugs, this is what it's going to do to your brain, this is what it might mean for your life. They do that with Life of an Athlete. They teach the athletes that, if you drink or you do drugs, this has a direct effect on your performance. And we have seen that it has made a difference with the students in the high school when you teach them that kind of science-based information. So we need to do it in the schools. We need to think about also this idea of making it more prevalent in the media. Do you remember when we used to have that commercial on TV, here's your brain with the egg, here's your brain on drugs in the frying pan? Remember that? We don't do that anymore. What we have on TV, we're pushing pills, right? We say if you've got this ailment, or if you're not feeling this, good this way, or if your stomach's bloated, take this pill. But we don't hear any more prevention education on drugs, and that needs to happen. So that's a prevention education piece. Enforcement. I believe that in the state of New Hampshire, if a drug dealer sells drugs to somebody that leads to an overdose death, that dealer needs to be tried for murder. And if convicted, face life in prison without parole. We need to be dead serious, and under a Forrester administration, there will be zero tolerance. I have a very good friend of mine, her son, at the age of 21, she found him in his room in the morning, and he had overdosed on heroin that had fentanyl in it. This young kid had worked on one of my campaigns. I had stood next to him, at the polls. And the morning she called me, told me that, I was just devastated for her. So, and I've seen what she's gone through on this issue, and the kind of the feedback and talking to law enforcement about the drug dealers, has no sense of remorse of what he did. In fact, he was told that what he did had caused this young man to die, and he said, well, it was his choice, and he went out and sold the same, he continued to sell the same drug. Well, we've got to stop that. And I'm not talking about, people who do drugs to support their habit. That's different than the professional drug dealer, and we need to be very hard and harsh.
Does that require a change in law to make that happen, or is it an emphasis of a forester administration?
It's an emphasis, and it again, it comes from the corner office, and it's having this conversation, whether it's with the judicial system, with law enforcement, with everybody in the state, about we're going to be very serious about this. I mentioned earlier there are 2 candidates who believe we should decriminalize marijuana in the middle of a heroin and opioid crisis that we're talking about. Decriminalizing marijuana makes absolutely no sense to me. Absolutely no sense. And, I heard from one of the candidates, 2 reasons. He said, we've got our jails filled with people who are there for small amounts of marijuana. And his second reason was that our crime labs are backed up because of this, small amounts of marijuana. You talk to law enforcement, and they will tell you the people who are not in our jails for small amounts of marijuana. So that notion is disabused. The second reason, this idea that the crime lab is backed up. So I called the head of the crime lab, and I had a conversation with him, and I said, is it backed up? And he said, yes, Jeanie, we get 750 cases a month, and we're able to, with 6 staff, able to process about 550, but it's not because of small amounts of marijuana, it's because of heroin and fentanyl. And we do have cases that have to do with marijuana, but we're talking about pounds of marijuana, not small amounts of marijuana. We heard, when I sat on the drug task force, we heard from law enforcement, we heard from medical professionals and recovering addicts that marijuana is a gateway drug. Now, you may disagree, I don't know, but the fact of the matter is when we're in the middle of a crisis and we have all the experts who are telling us it is, and this is a problem, and the nonprofits who deal with this at a local level, why would we decriminalize marijuana? So, again, it comes from the corner office. The person who sits in the corner office is going to say no to decriminalization, yes to getting tough on drugs and drug dealers, on the enforcement piece. It's critical that the person we put in there is going to be very serious about this issue. And the third piece is treatment and recovery. And so when I talk about that, we've seen a diminishment of the number of beds throughout the years in the state of New Hampshire. We need to build that back up. What that right number is and how we get there, we have to work on. On the front end, I believe we need to cut off the head of the snake, right? Stop people from getting addicted and stop the drug deals from happening. But on the back end, when we talk about treatment, until we get those, and I believe it needs to be private-public partnerships about creating these facilities. But until we get there, we need to be having a conversation, and as governor, I would be having a conversation with other states where they have the best programs, so that our people, when somebody is ready to get help, that we have that connection. If we don't have a bed for them here, that we have a connection, a relationship to get them in a treatment facility in a state that we have a collaborative relationship with. And then the other piece of that is this idea in recovery. So they've decided they want to get help. We get them the help. They get into recovery. Then what? And so one of the things I talk about is this idea of a certification program where the recovering addict goes through a certification, and it would be something we'd work with the business community about what that looks like, but then be able to get them the training and the skills so that they can go into a high-paying job, a good-paying job in the state of New Hampshire, whether it's machining, whatever it might be, software, technology, whatever it might be, but provide them the training so we give them their path out and up. So.
Do you think the resource level right now is where it should be, or do you? I mean, I realize these are all sort of compromise kind of things, but to to keep moving forward on attacking this problem, do you think there needs to be, granted you want the right programs in place, but do you think there needs to be more spending on that?
Not yet. I think, again, we're spending $101.5 million. In this session, we've put together some really great programs. Senator Booton led the effort on drug courts. We put in a prescription drug monitoring program, beefed that up. We've got rules on opioid prescribing. I sponsored the bill on Granite Hammer that pairs local law enforcement with the troopers and drug task force to find those high crime areas where drug deals are happening and stop it at a very local level. So we've done some good things. I believe it's really important that we're spending taxpayers' money, and we need to make sure that the money we spend is being effectively used and having results. And we still don't know, and I'm hopeful this week we'll find out. I had sent a letter to the governor early in August asking her to give us an update, as the chair of the Senate Finance Committee, asking her to give us an update about where we are with spending, because we don't know, and where we are with the programs. And this week she is hosting an event or a presentation, I think it's on Wednesday, to talk about just that. So I'm really going to be interested to see where we're at on this issue, because we really kind of don't know. I've talked with the Commissioner of Safety on the program that I introduced, the Granite Hammer. Where is it at in the process? And the applications, at least when I talked to him a couple of weeks ago, he said the applications were due out to the communities, but I'm still not sure where it's at.
You said that you'd be open to considering and looking at approaches and methods and programs that other states might be using. Is there anything specific on your radar that you've seen or that strikes you as having some really good results, some traction?
In other states?
Yeah.
The first thing that comes to mind is it's a program, and I think it's happening in California, and it's called Every 15 Minutes. And it gets young people to actually go through a process of, it's almost like, what was that program, Scared Straight? Almost along that. Have you ever heard of it, Every 15 Minutes? It's sort of like that. It really puts them in a real life position of what it's like and what it could mean for you and the impact on your parents. So they go through this whole role play that it's very real. And it's for high school students, and they go through the process of seeing that their parents are being told that they were in a car crash because they were, in something to do with drugs. So it's like I say, it's a Scared Straight kind of model, but it's called Every 15 Minutes, and that seems to be something that is very interesting to me that I'd like to take a look at. But right now we have some good programs now. Life of an Athlete, I think, is a good program and is having some effects, and schools are using it. Certainly, I don't think that we need to reinvent the wheel. When it comes to the prevention education piece that I talked about in my drug plan, when I came up with that, I didn't do that in a vacuum. I sat down with the superintendent, the principal of the school, a former substance abuse counselor, a local nonprofit that works on this issue, and we talked about what that looks like. And they, at that time when we had the meeting, said there were other programs out there that we would look at that would be, that we know has been vetted, works, and really looking at it, making it a New Hampshire plan.
A topic that's somewhat related to the drug abuse crisis and has some of the same dynamics as mental health. State has a paucity of treatment beds, and there have been issues recently with New Hampshire Hospital. We've had some closure of the mental health and behavioral unit here at Cheshire Medical, and a lot of people are still on waiting lists to get mental health services through DHHS. How would you approach dealing with that situation?
You mean, so you're talking about mental health beds?
Beds and treatment.
Okay. So Well, I just want to be clear. Are you treatment for mental health or substance abuse? Are you talking about?
No, separating out substance abuse and just looking at, I guess, more mental health itself.
Okay. So, yes, and I'm sure you know, substance abuse and mental health are co-occurring. They work together. And the governor, as you know, did settle that mental health settlement. And we're not sure where that program is. We're kind of waiting to hear how that's working. We get a report once a month when we have fiscal committee, and the Department of Health and Human Services reports in on where we're at. Relative to the mental health beds, I was deeply concerned and disappointed that we had not been proactive, or the governor had not been proactive in looking out. We funded what she asked for the mental health beds, because I believe we all feel that's an important issue. Why was no one looking forward to say, are we going to have the staffing that we need? And as governor, in a situation like that, I would have looked out. You're always looking 3 or 4 steps ahead about what's coming down the road. You're just not focused on one issue. So in terms of what I would do now that we're here, it's really, I guess, meeting with the hospitals, meeting with the New Hampshire hospital itself, talking to them about how do we attract the psychiatrists that we need in this state. Why are we not moving on this? What's the bureaucracy involved? How do we streamline so that we can make sure we get the doctors in here that we need right now?
So you feel that the state is putting enough in resources to the problem, and that's just a question of how they're being prioritized?
Yeah,
or?
we funded, and remember, the governor negotiated the mental health settlement, and we funded it per the settlement. So I would say that they've laid out the program about what the resources were needed. Although I can tell you, talking to my community mental health facilities in my district, part of the problem we get into is the managed care and how those rates are being set. And I know the community mental health centers are struggling a bit. So that all needs to be worked out as well. But in terms of funding it, we funded it per what the governor settled. We don't have, at least I haven't heard very specifically a presentation on how that funding is going out there, how the programs are working. It would be nice to have an update. I mean, just like anything else, you want to, you spend the money, you put the money out there, you want to know, is it being spent, how's it working, before we start throwing more money at the problem.
The cost of higher education and the high debt load that students who graduate in the state carry, and they're pretty well chronicled. Could you talk a little bit about what kind of leadership you might bring to reining in the cost of higher education in New Hampshire?
Sure, and I think we've actually started down that road already in terms of developing a better relationship with the university system, the colleges. As the chair of the Senate Finance Committee, when you build the budget, when the university comes to us and they just tell us a number, we don't see the line by line like we see in other state agencies or departments. This is just what they want, and that's all we know. So I think when we should really consider having legislation that requires the university to provide us more information on how they're spending the money. It's a hard sell when they're spending $17,000 on a desk. If there's not confidence that the money that we're giving the university is being spent wisely, it's hard to want to give more. And you can hear those stories. I've heard them in the 6 years that I've been here about how that money is being spent, and is it being spent wisely. So to go to high student debt load, I would prefer to see if money we spend go to actually the student and let them make that choice rather than going to the university. scholarships going directly to the students. So,
This is just a deeper vetting of the sort of budgets then that
yes,
would be called for.
yes.
That might be useful.
Yes, it would be, because then it would, I think, build confidence in how much money, and if we give more money to the universities and the colleges. Certainly, I think the colleges are doing a good job. I think the communication has been good there. I think it's getting better with the university. When I talk to students who, go to the colleges, one of the things I've heard is that this idea that they should almost have a menu of options. I don't want to be part of the, food service, so take that off my bill. I just want this. I don't know what that looks like. It's not a conversation I've had with the university, and it's one that I would want to have about how do we affect change that gets the students who can't afford the high cost of that education. Is there a better way, a better model that we can move forward on? And again, it's working with the university and the college system, because I think working together you're going to get to better solutions.
So New Hampshire has a 10-year transportation plan, but we have a lot of red-listed bridges, a lot of roads that are in need of attention. When the gas tax was recently increased, you had opposed that. How would you deal with getting the resources to the Department of Transportation to get those projects dealt with?
So, the 4.3 cent gas tax. When it came to the Senate, we actually introduced language to make sure that that money went towards roads and bridges. And I think we're doing a good job with that, the revenue that's come in from that. Certainly we're seeing construction all over. Actually, that's why I'm late. and I'm happy to see that the money is out there, and the roads are getting rebuilt, and some of the bridges are as well. I think it's not so much getting more, but making sure the money that we get is being spent effectively. And Department of Transportation there are different pots of money that you can spend on, so it's not really interchangeable. But it is frustrating when, especially for the public, when what they perceive to be wasted resources on things that don't seem as necessary. And I'll give you an example. This is kind of my popular story is the rumble strips. Have you heard about the rumble strips?
Oh, yes.
Oh, you got them here?
Clear.
Okay. So well, in Plymouth, they put the rumble strip down the center of the road in a residential neighborhood where logging trucks go through. And, at 2 o'clock in the morning, people are very unhappy. And they didn't have a conversation with the community, they just did it. And the community was very angry about it. And to their credit, the assistant commissioner did come out and meet with the folks. The short end, just to make a long story short, they're now going to remove the rumble strips. But think about the money we spent on human resources and financial resources to put the rumble strips in, to make people angry. Now to turn around and take those rumble strips out and use the human resources to do that. How much did that cost? I don't know. I'm sure it wasn't like huge amounts of money, but for the average citizen, when they look at that, they say, why do we waste all this money when that bridge down the road here, we could have put the money towards that, because that needs to be fixed. That's a crisis. Mm-hmm. And so I guess one of the things I think is important is to think about how can we work, whether it's with the federal government, about the resources that we get, and having more of a say of how that money gets directed to things that are more of a crisis in nature than the things like rumble strips. And some people will say, well, rumble strips protect lives, and I get that, but I can tell you in the town of Tilton that I represent, there's a section where the guardrail is gone, and the drop is like 30 feet. You know, it's dangerous, and it's dark there at night, and if people are walking, I mean, that to me is more critical than fixing that guardrail than putting a rumble strip in an area where people say there are no issues. So it's that's the kind of thing we need to fix too, and it's what I talk about when I go out on the stump, is this idea that there has been a really erosion of trust between the state government and the people. And we've got to get back to a place where we're talking and that trust is built up, because the reaction, I can tell you, in this meeting was just so much anger. And, you know, I think the Department of Transportation's trying to do the right thing, but it didn't get implemented the way it probably should have, and having that conversation. So as a consequence, you make that mistake. It's hard going back on that.
In parts of our region, the rumble strips are more affectionately known as grumble strips. Senator, there's a likelihood that during the next biennium, Michael Addison is going to be due to be executed.
Mm.
As governor, how do you react to that likelihood?
Well, I support the death penalty. I have been very supportive of our law enforcement, and this issue has come up a couple different times during the sessions trying to repeal the death penalty, and law enforcement believes we need to keep that penalty. It is for only it's home invasion and death of a law enforcement officer. And talking to county attorneys and other law enforcement, it's used very infrequently in the state of New Hampshire. The question I hear a lot about is what do we have in terms of the method and the chemicals and all that. So that's something I'm not sure where we're at with that. But the bottom line is I support the death penalty, and this gentleman killed a law enforcement officer, and I support the death penalty.
So, I believe that Michael Addison used a gun in that crime. You're a Second Amendment supporter.
Yep.
How do you balance the lives of innocents in law enforcement with supporting Second Amendment rights?
Well, I guess I don't see the connection to that. I am a strong supporter of our Second Amendment rights. I believe anyone who has the legal right to own a gun should have a gun. I guess I reject the premise of where you were going with that. I don't see the connection.
Well, if we're having nationally, and thankfully we haven't really had anything here, a number of mass shootings that bring this to a boil as a topic. The access to guns, and you mentioned people who legally have access. Do you think that the laws that are on the books now are deal with that topic adequately?
Yeah.
Who should have a gun and who should not?
Yeah, I think the problem that we need to address is this of the mental health issue. It goes back to mental health, and are we making sure that that is part of the balance? And one of the things I get concerned about when we talk also about mental health is I think about the young waitress in the local restaurant that I go to, and she lost her mother a few years ago. She substance abuse, mental health issues, and Megan had to see a psychiatrist for a while and to get herself just kind of through this process. And she said to me one day at breakfast, there must have been something in the news, and she said to me, and she's like 22 years old, and she said, Jeanie, I don't want my right to own a gun being taken away from me because I saw a psychiatrist. she said it was a temporary thing. I'm fine, but I'm really concerned. And so it's something we have to be very cautious about as we move forward, that situations like that where, that their rights to own a gun are not infringed upon. But to suggest that to suggest that the gun is the problem, it's the I think more so folks who have some kind of mental issue that is a problem we have to deal with.
You touched earlier on the idea or the importance of keeping workers here in this state. Could you offer 3 steps that could be taken right now to assure that that happens to a greater degree than it is?
Sure. So I laid out an economic plan for the people, and there are 3 parts to it. It's how to make it easier to start a business, run a business, and earn a 21st century living. And one of the first things I would do as governor, and I did it at a local level as a Main Street director, so I know it works, is I would go out and sell New Hampshire. And what I mean by that is top business leaders in the state, join with them and go out and attract businesses into our state to bring in those good paying jobs. We don't do enough to market and promote our state. We have an awful lot of good things going on in this state, and we should be doing more of that. So that would be the one thing. A second thing that I think could be an attraction to businesses is doing an inventory of the state of what we have in terms of possible empty land that the state owns that they're not using, and possibly using that as an attraction or incentive. So you say to some company who wants to build a biotech company, come into our state, we will lease you this piece of New Hampshire state-owned land, let's say a 99-year lease, 50-year lease, whatever it might be, for $1, and possibly look at some kind of deferred tax. I don't know what that'd be, but that's something, open as a concept, and then get them to move into the state. It's an incentive we could use. And then finally, one of the other things I think is really important that I would do is get a kind of a networking group of small, medium, and large businesses who sit down and tell us through their experience and going through the regulation, the hurdles that are getting in their way, and how do we reduce or streamline those regulations to make it easier for them to run their business. I think about last week, I visited with the business in Milford, and he wanted to expand his business, and he was willing to give up a lot of his land in exchange for being able to move out his building a bit. I don't have the exact dimensions, but it was going to go into wetlands, and he needed approvals. He got the approvals from the town. Then it was on to the state, and the hurdles and the delays that he faced because he didn't, might not have signed right on one sheet of a form, set him back 30 days, and then there was some other little thing wrong and set him back another 30 days. And this gentleman expressed his frustration to me that, I could have been growing jobs. I was ready to expand. I'm ready to expand and create more jobs, but I've got these hurdles with the state that are getting in my way. And to their credit, I brought it to the attention of somebody at DES, and they got right on it, and everything got taken care of. But it was just the delay in the process and the bureaucracy. But we need to have that conversation with all these businesses, because we know business retention is easier than business recruitment, and we need to hear from those businesses what are the things that are happening that are delaying them from expanding and growing in the state.
One of the things we tend to hear a lot is that there's a disconnect between the education of the workforce and what their needs are. So is there a specific way to address that?
Sure. So when I was a Main Street director, I live in Meredith, and we have, it's a tourism-driven community, so we have restaurants, retail, hotel, right? Yep. And they were having a struggle finding help, employees. and the students in the high school wanted jobs but couldn't get the jobs because they weren't qualified for the jobs. They didn't, just very simple, basic types of things that they needed to learn about showing up on time, being able to count, being able to communicate, the basic kinds of things in a service industry. So I worked with the superintendent of schools and local business leaders and the principal of the school, and we created what we called a career partnership program. And basically it was getting into the schools with a speakers bureau of businesses in the community who wanted to be involved. We did job shadows, internships, we did community service, and then we did job fairs. And so we were able to create an environment where these young people were learning and they were getting the skills they needed, and we were pairing them with businesses, and it really helped. It really helped the community, and we had some great success stories that came out of that. So that's something I would want to take, and I talk about in my economic plan, is taking that to a state level, doing that statewide. I was at a business the other day over in Newport, and was it Newport? No, it was the place in Milford, and he was telling me he'd been looking for CNC machinists and couldn't find CNC machinists, and ad in the paper, couldn't find any. But then he added 2 words, will train. And he said he got flooded with people who were now interested. And so I don't know if what's going on out there in the environment is that people don't believe they're qualified and they don't even look. But because he added those 2 words, he got all these applicants. And then I was over at a garage door place the other day, and I was telling the guy the story because he had a sign on his lawn that said "We'll train," and he said, "Yeah, I found that too. That just those 2 words make a difference in terms of my getting the help." So it's the collaboration with those businesses that have learned how to get the applications. It's bringing this again to the state level of businesses being a partnership with the colleges and with the state about how we turn this around and make sure that the businesses get the workforce that they need. And by the way, not every young person is meant, to go to college. And I feel that we need to encourage them, if they want to go to a VOTEC school, that's okay. That's perfect, and they can earn a good living with that, and provide them other opportunities than other just saying you need to go to a 4-year college.
Among people who don't earn a really big living are the people who are being given health insurance through our expanded Medicaid, which I think you supported. You would like to repeal the Affordable Care Act. If that were to happen, what would you put in place as governor to deal with the people in New Hampshire who would lose that health care?
We know now, or at least I do, I should say, based on conversations that I've had with constituents in my district, that the Affordable Care Act is not working. People are falling through the cracks. I hear it all the time. You didn't get to keep your doctor. You didn't get to keep your health care. You have these high deductibles. People, I can't tell you how many people that I've talked to who say they just don't have health insurance because they can't afford the high deductible, they can't afford the insurance premium, so they're just taking a chance and they're paying the penalty. I don't think that was what it was ever intended to be, but that's where we're at right now. We need to fix that. So one of the things that I think in the healthcare, we need to look at a couple things. Health savings accounts. I think in the state of New Hampshire, for state employees, we need to encourage that. That it puts the employee, puts the consumer in the driver's seat. And with a health savings account, we can have that money put into their account, roll over year after year, tax-free, and they get to decide how they spend those dollars. we provide them the tools so that they actually shop for their care, and they look at, we put everything on a site so that they can decide, what are the choices that I have, what is the best quality of care, where can I get it at a better price, put them in charge of that. The other thing I talk about with my health care plan is this idea of, for those folks who don't, let's say at the lower end of who can't afford, who are on Medicaid expansion now, the new Medicaid expansion, this idea of what they're doing in Florida right now, it's called voluntary health care. And I don't know if you've heard about this, voluntary health care. So they're doing it very successful in Florida, and they've been doing it since 2010, 2011, and they've provided, I think, $2.6 billion in free health care for, I want to say, over 400,000 people. And essentially what it is we, as a state, would indemnify providers who would provide free health care to those who couldn't afford it, who couldn't pay for it. They get continuing education credits. This is the way it works in Florida. In New Hampshire, we'd want to make it sure it works for New Hampshire, because Florida is different than New Hampshire. And we indemnify those healthcare providers so they avoid the costly malpractice insurance that goes along with it. And what they showed in Florida, that of the $2.6 billion in free healthcare that they provided, and all those lives that they helped, that they spent, I think there were like 4 or 5 lawsuits, and they've spent maybe $200,000. So it's an option, or it's a solution, something we should look at. And I actually did file the legislation. It passed into law, and I will be on that committee this fall, I think, looking at. But it's getting, again, it's getting the healthcare providers in the room, whether it's doctors or the nurses or the dentists, to talk about, does this make sense for New Hampshire? Is it an option? How do we make it work?
Not that you would necessarily know everything about how that program works, but it strikes me as maybe the state being in an odd situation if it's indemnifying these providers, and then somebody actually does something that's negligent.
Yep.
Is the state then on the hook to defend them, even if it knows that, geez, they probably didn't know? Would the state settle in that case?
Well,
or?
that's a detail we need to get into for New Hampshire and how that would work. But we know now, because I've been to those places, that you've probably heard dentists with a heart who provide 1 free day of dental care for anyone who wants it. And you come in, and whether you need an extraction or preventative care, they're doing it now. They're doing it in different pockets. And in fact, what I heard the other day was that actually and I have to look at this, but there was an organization on the Seacoast who was doing this, who, when the Affordable Care Act came in, at least that's what I was told, that could no longer be in existence. So my point in saying any of this is that there are places that do it now, intermittently, a day of free care here or there. And if we could, because I think we know in New Hampshire that we have a very generous population and people who volunteer and help in community, we need to explore that in New Hampshire. And what that means for the state in terms of indemnification, how that works, those are the details we have to work out.
One of the theories, at least, of the Medicaid expansion, as I understand it, was that it would promote people who couldn't otherwise afford health care access to more preventive care. So I grant the Florida solution may not be what you're necessarily proposing, but does that kind of approach promote that, or is there some way to salvage the Medicaid expansion, at least to the extent that it might promote preventive care? Because that ultimately leads to cost containment, is the theory.
Well, and I think volunteer care would be that as well, preventive care. But in terms of salvaging Medicaid expansion, the concern I have right now is the state of New Hampshire is on the hook for that piece that the federal government is not going to pick up, and how are we going to pay for that? And I was not convinced in listening to the House testimony from the way that was going to be picked up. I was not convinced that it was going to work, and in fact I had heard from one hospital that they weren't sure they could make that payment, because you heard that the medical providers and the insurance companies said they would make up the difference for that. So, and one of the things that I hear from some medical providers, at least the ones that I've talked to, is that Medicaid expansion provides preventive care, but a lot of these folks haven't had care for a long time, so it's not preventive care they need, right? Let's just take a dentist, for example, or a dental patient that for years have not, getting a cleaning. They don't need cleanings, they need an extraction, right? So the system is not working, and I think in New Hampshire, the citizens in New Hampshire, I believe we all agree people need to have access to affordable health care, and everybody wants it, but I don't believe it's working for New Hampshire based on the conversations that I've had with people. And my fear is that we assume that everything is good and we move on, and we continue to have people fall through the cracks.
Okay.
All right.
Well, I don't have any other questions. I don't know if other
We go to commercial.
people on the board, or is it,
I have a question. It's not a policy question, but maybe just quickly. Are you struck by anything in particular as it relates to voter sentiment out on the campaign trail these days? Anything strike you, surprise you?
I think people are still kind of recovering from the presidential primary, so there doesn't seem to be a focus on it, and I think people are now starting to focus on it. I mean, people who are actively engaged in politics are paying attention, I would say, but most folks are still getting over the presidential primary, and it's summer, and they're...
Don't want to answer their phones.
Right. But, the issues don't surprise me when I talk to people, when I go out and do ice cream socials and meet with people in their homes. It's jobs in the economy. How are we going to get the state moving forward? It's the heroin and opioid crisis. It's energy. So those seem to me the things I hear the most.
if people are still a little bit reeling from all of the heavyweight politics that happened back in February, you've only had 2 weeks to convince people that you're their best option among your party for governor.
Yeah.
That must be quite a challenge to get them focused.
No, I disagree with you on that, because since May, since I announced, I have been out there very grassroots, and so when I say people aren't, well, when I'm talking to them now, they are. You know what I'm saying? Now they've become aware. So I think I've laid a really good groundwork for awareness and about why I'm running. And certainly in my, my district north of Concord, I think that my reputation and who I am is out there. It's in the southern part of the state that we've been actively engaged in, and we've had really good response. People, at least the people, when I come to these events or I host these events, people are coming and they're getting engaged. But let's say when I knock on doors, I've been surprised sometimes when people don't know, but they know then, right? I'm running for governor. Hi, I'm Jeanie Forrester, I'm running for governor. Now I've made that contact. So, but yeah, the next couple weeks are going to be fast and furious.
Yeah, I bet.